Hi, I'm Megan, and this is the role and impact of the Joint Commission in healthcare. Imagine you walk into a hospital, you haven't spoken with a doctor or a nurse, but there's already a sense of confidence that the care you're about to receive will meet national standards for safety and quality. That feeling doesn't just come from the hospital itself, it comes from the Joint Commission, the largest healthcare accrediting body in the United States. The Joint Commission, often abbreviated as the TJC, was created to make sure healthcare organizations provide safe, effective, and reliable care. In this presentation, I'll go over the history of the organization, what it does, how accreditation works, and the standards it enforces, why it matters so much for both patients and healthcare providers. I'll also share some examples and insights to help show the Joint Commission's direct impact on patient care and safety. The Joint Commission was established in 1951. It's an independent, nonprofit organization founded to improve healthcare quality and safety at a time where there was no consistent nationwide system for evaluating hospitals. Back then, healthcare was expanding rapidly. New hospitals were opening, medical technology was improving, and patient care was becoming more complex. But there wasn't a reliable way to make sure these hospitals were safe or that they were providing quality care consistently. The Joint Commission stepped in to fill this gap, creating standards and processes that hospitals could follow to improve safety and outcomes. Over the decades, the Joint Commission has grown to become the gold standard for healthcare accreditation in the United States. It's recognized as a symbol of quality and excellence. Hospitals and healthcare organizations view the TJC accreditation as a mark of credibility and trust. Today, the Joint Commission accredits and certifies more than 22,000 healthcare organizations and programs across the United States. This includes hospitals, nursing homes, ambulatory care centers, behavioral health facilities, and even home health services. Accreditation isn't just a symbolic stamp, it can directly affect whether a hospital receives funding. For example, hospitals often need Joint Commission accreditation to qualify for Medicare and Medicaid reimbursement, which are crucial for financial stability. It also is important to note that the Joint Commission reach goes beyond large hospitals. Smaller clinics, outpatient centers, and even specialty programs such as cancer care or behavioral health services rely on TJC standards to ensure that they are providing safe, effective care. This widespread influence ensures a consistent level of healthcare quality across the country. So how does a hospital or clinic earn accreditation? This process is thorough and detailed. It starts with the preparation phase, where the healthcare organization reviews its policies, procedures, and outcomes to make sure that they align with the TJC standards. Hospitals often spend months preparing, reviewing everything from staff training programs to infection control protocols. Once ready, the Joint Commission conducts an on-site survey. These surveys are done by trained healthcare professionals who evaluate compliance in real-world practice. They don't just look at paperwork, they observe care being delivered, talk to staff, and even interview patients. The Joint Commission maintains a comprehensive set of standards that covers all aspects of healthcare delivery. These standards are updated regularly to reflect the latest research, best practices, and emerging safety concerns. A key initiative in the National Patient Safety Goals. These goals target areas where mistakes can be particularly dangerous and where improvements can have the greatest impact. Some examples include preventing surgical errors, such as wrong site surgeries, reducing hospital-acquired infections, ensuring accurate patient identification, improving communication among healthcare providers. For instance, imagine a patient who needs surgery. The safety goals ensures that the surgical team confirms the correct patient, procedure, and site before anesthesia. These small steps may seem routine, but they prevent serious errors and save lives. The Joint Commission also addresses broader issues like how hospitals handle emergency preparedness, infection control during the pandemics, and patient-centered care practices. By focusing on high-risk areas, the TJC helps hospitals continually improve and prevent harm before it occurs. Accreditation brings measurable benefits to hospitals. Organizations that are accredited often see fewer medical errors, better patient outcomes, stronger financial stability, and more. Hospitals also report improved staff engagement. When their staff know the organization is committed to high quality standards, it creates a culture of accountability and pride. Everyone from leadership to frontline nurses is motivated to maintain and improve safety and quality. The TJC standards also encourage organizations to adopt evidence-based practices. For example, hospitals may implement new infection control protocols, better hand hygiene programs, and electronic medication tracking systems to meet the TJC standards. Over time, these changes result in safer care for patients. For patients, accreditation is a huge reassurance. It's a stamp of approval saying that the hospital has been evaluated and meets national standards. Think about it this way. Just like schools are accredited to show quality or food is inspected by the FDA to ensure safety, hospitals need a trusted way to prove they are safe and effective. Accreditation helps patients feel confident that they are receiving care that meets rigorous safety and quality standards. For families, it can mean the difference between feeling anxious about care and feeling secure knowing their loved one is in a safe environment. This is especially important in high-risk situations like surgeries, intensive care units, or emergency care. To put this into context, consider a hospital that faced repeat infections, outbreaks in its ICU. After reviewing the Joint Commission standards and implementing recommended practices like updating hand hygiene protocols, proper isolation procedures, and staff training, the hospital reduces infection rates significantly. This example shows how the TJC standards don't just exist on paper, they drive real measurable improvements. They save lives and improve patient experiences. The Joint Commission isn't just about accreditation. It also provides resources to help hospitals improve. This includes education programs, research, initiative, data, and tools that allows hospitals to track performance and implement changes. For example, the TJC provides training in infection prevention, patient-centered care, and emergency preparedness. Hospitals can use these resources to educate staff, identify potential issues, and implement improvements. TJC also collects data nationwide, which helps hospitals compare outcomes and adopt best practices. This collaborative approach allows hospitals to continuously improve and even beyond meeting minimum standards. Going back to the hospital scenario, you walk in and you haven't met anyone yet, but you feel confident that the care you're about to receive will be safe and effective. That confidence comes from the Joint Commission. Since 1951, the TJC has been improving healthcare across the United States, accrediting over 22,000 organizations, enforcing rigorous standards, and promoting continuous improvement. It impacts patients, staff, and hospitals in a meaningful way. By setting clear expectations, providing guidance, and encouraging ongoing improvement, the Joint Commission ensures that the healthcare organizations maintain a culture of safety and quality. For patients, this means confidence and reassurance. For hospitals, it's a roadmap to excellence. Ultimately, the Joint Commission plays a crucial role in shaping safer, high-quality healthcare every day.